I guess if we improve diagnostic ultrasound in our community and every specialist have this access to have an ultrasound device and do the diagnosis in the clinic, it would be very helpful because ultrasound is very, compared to other devices, cheaper and is available in portable. And if they know how to do diagnostic ultrasound in the cervical region and found the cause of the pain, and then do a diagnostic injection, it would be very helpful, and maybe it may prevent into doing surgery. In a persistent case, yes, they can refer the patient to the surgery. But I guess ultrasound, diagnostic ultrasound is a new feasibility in this new world. And every specialist must have this expertise to work with ultrasound in any field, not just in TOS,